Sony George, Head of the Department and Consultant Ophthalmologist at Medical Trust Hospital, Cochin. Today we will be discussing about ocular allergy or the allergies of the eye. So what do you mean by allergy of the eye? A person who gets frequent itching of the eyes, watering of the eyes, discharge, etc. on and off, especially when the person goes out into a dusty area, etc., is usually called as ocular allergy. So, who gets the allergy? Any age group of people can get allergy. It's more frequently found in children because these children run around all over the place, they get exposed more to the dust, plus to the pollen grains, all these things. Usually in children, although they have allergy, there is a chance that the allergy can disappear after a certain age because they are getting exposed daily to some amount of new allergic material, and by the time their immune system develops finally, they may end up getting rid of the allergy. But usually in an adult, if it happens, it is going to most of the time stay with you. So you will get keeping repeated attacks. Unless and otherwise you move out of your city or your surroundings which contain the allergic material. Like for example, you are living in an area very near to a farm or something like that, then from there a lot of pollen grains come. Probably if you move from there, you may get rid of the allergy. Or if you move your city, like for example, Parthenium allergy may be found in certain cities and not in the other cities. If you move, you may not get that kind of allergy. So what is this allergy actually? It is just a hyperreaction. Like a normal person, if he gets lot of dust into his eyes, he will get itching. But even with a minimum amount of dust, when you get itching, it's called ocular allergy. Similarly, like when you go into a dusty place, a normal person may get some amount of breathing difficulty. When it is more, it is called asthma, like with minimum exposure. Similarly, ocular allergy also is a hyperreaction. Now, how do you get rid of allergy? The most important part is to avoid getting the allergic material in the eye. This can be done by wearing some protective eye glasses or goggles. Second thing is to avoid long stay of the material inside the eye. For this, you need to wash your eye frequently so that not much of the material remains in the eye. Third and most important, you need to consult your doctor, the ophthalmologist, and check whether it is allergy itself or something else and get treated accordingly. So, how do we treat it? Okay, medicines wise, in very severe cases, you may need to use very mild steroids for a limited amount of time under the supervision of your ophthalmologist. The second is a preventive medicine. Okay, we have medicines called mast cell stabilizers and antihistaminics, which when you use it for a very long time or a prolonged time, it will decrease the chances of allergy. So what happens? The cells in the eye which produce the chemical called histamine will be made stronger so that less histamine is released. And these medicines can be safely used for a prolonged time. You have examples like Kafta or Alcaftidine, which is a mast cell stabilizer. You have similarly other medicines also. So this may need to be continued for a long time. This allergy will keep recurring. So point number one, allergy is not a dangerous disease. It can recur, so don't worry about it. If you take medications and if it happens again, nothing to worry. You go back to your physician and get your medicines and continue the treatment. You can use lubricants like glide tears or tear drops, which will give you soothing effect. And keep consulting your doctor in a regular manner. I hope my talk was interesting. Thank you very much.